So first we will be talking about the benign tumors, and then we'll be talking about the malignant tumors. Depending upon their epithelial and non-epithelial origin, we have different types of the benign tumors like adenomas and papillomas, and they're coming from the epithelial origin. So talking about, we have the papilloma and adenoma, and already discussed that they are epithelial in origin and they're coming from the epithelial cells. Then there can be multiple biliary papillomatosis, and it's not just papilloma would be just an epithelial tumor, and it would be confined to one part. But papillomatosis is actually the phenomenon of the developing of the multiple papillomas, and it can be involving the whole of the biliary tract, and they do not follow any kind of a sequence. There can be granular cell myoblastoma, there can be neural tumors, there can be leiomyomas, and there can be hemangiomas as well. So talking about papilloma, adenoma, and multiple biliary papillomatosis, these are actually the tumors which are coming from the epithelial origin. The granular cell myoblastomas is actually showing that it's a myoepithelial origin, and it's involving the connective tissue, the stroma, and the myoblast. The neural tumors are actually coming from they are actually the neuroendocrine, and there can be leiomyomas, and there can be some of the endocrine tumors which are not very common, but they can actually make a bulk of these the endocrine tumors, and one of the category of the benign tumors. Now, if we talk about the presentation of the benign tumors, then there is possible that the patient can have a dull ache, right hypochondrium pain for a considerable time. In case of the benign tumors, we know that they are very much well demarcated, and they have regular margins, and there is no irregularity, and they would be uniform, they'd be well circumscribed. And the good thing about these tumors is that their prognosis is very good. Okay, and if there is a palpable mass, most of the time these benign tumors, they're not palpable, but sometimes they become palpable. And if these tumors if there's a right hypochondrial mass and it's painless, and you have to inquire about the duration, and you have to inquire about different kinds of other different pathologies, like the history of cholelithiasis, history of cholelithiasis. You will be inquiring about primary biliary cholangitis. You'll be inquiring about ulcerative colitis and Crohn's disease and chronic inflammatory disease, because they have a relationship with that. And then you might be possible. There's some parasitic infections like Ascaris and cloneric and they are because of the chronic inflammatory processes, and there is a repeated fibrosis, and then that can lead to the development of the tumors. So there would be no history of the weight loss if you are dealing with the benign tumors of the bile duct. And good thing about these is they have a very good prognosis, because the margins are very well circumscribed, and you can easily go for a total resection. And obviously, if the margins are clear and it's a total resection, then the prognosis is very good, and the survival rate may increase up to many years. Talking about the papillomas and adenomas, and these are most commonly the intrahepatic in origin, and most commonly sometimes it's involving most of the time the intrahepatic part of the bile ducts, like you can see here that we talk about the intrahepatic portion. So these confluence in some part of the right hepatic and the left hepatic ducts, they are most papillomas and adenomas that are involving this. And the patient may present to you with a jaundice. Why the patient will present to you with a jaundice? Because obviously even if the tumor is benign and it's well circumscribed and it's very defined in its location, and it might be possible that it's obstructing the lumen, and because of the obstruction, there would be stasis of the bile, and the patient will present to you with a jaundice. It's possible that it's a painless jaundice, but sometimes patient can have a dull ache pain. But usually in case of the benign tumors, the pain is not a definitive clinical symptoms which is going to present to you. There can be a history of a gallstones. There can be history of primary sclerosing cholangitis. There can be history of other conditions like parasitic infections and cholelithiasis, or there can be history of family history of malignant disorders and the benign disorders related to the hepatocellular Now we talk about the treatment. So I already described about the treatment options that you can, with a good prognosis is like you don't need a radiotherapy, you don't need a chemotherapy. The good thing is you can handle it with a total resection and with the negative margins. So talking about if you the CT and endoscopic ultrasound, that's really going to help you with the extent of the tumor and how much of the this papilloma, and usually these tumors are above the basement membrane, so you're not very much concerned about the invasion because they do not invade as compared to the metastatic disease. So most of the time they're above the basement membrane and you can easily go for resection. For those tumors which are involving the wide area, like we talk about the papillomatosis, so the treatment is like you go for the wide local resection, right? And in case of some tumors, it's possible that along with a wide local resection, you have to go for some other options, like maybe partial hepatectomy could be an option. But the good thing about these tumors is their good prognosis, and the complete resection of the tumor is quite possible for these benign tumors. They are different from the malignant tumors because in malignant tumors, it's very difficult to attain the margins, and you have to decide about the resectability as well. So the option and the decision that the tumor is resectable or not, that entirely depends upon the invasion. So most of the time, these benign tumors are above the basement membrane. So that means that there is no invasion to mucosa, submucosa, and the different layers. So you can easily resect them. And if there's a wide papillomatosis, then you can go for the wide local resection and you can combine it with partial hepatectomy if possibly present in that patient. Papillomatosis is defined as the process of the formation of the different papillomas, and they're not limited to one definitive portion. It's possible that some of the part of the liver and some of the segments of the liver, they're also involved. Possible that there is the intrahepatic papillomatosis, or there is hilar, or the distal part of the bile duct may be involved. But sometimes these papillomatosis, usually they're painless tumors, and they're benign in origin, and they behave as a benign tumor. But because of the involvement of the wide area, you have to go for the wide local resection. And sometimes it's possible that because of the widespread area and that involvement of the different segments of the liver, you have to end up your patient on different kinds of the surgical options like partial hepatectomy, and it's possible for a widespread tumor you go for cholecystectomy if it's a very widespread tumor. So if we talk about the papillomatosis, sometimes it's complicated by cholangitis. Usually these tumors, they're painless, okay? But sometimes because of the stasis of the bile, they can be superaided infection, they can be superimposed infections, and because of that, the patient can present to you with a cholangitis. So recalling the previous knowledge, I told you that if we talk about cholangitis, we have a Charcot-Triad for that, and the Charcot-Triad includes three important signs, which is the right hypochondrial pain and tenderness, the patient would be febrile, and there would be jaundice. So if you are combining these three things, they make up a Charcot-Triad, and Charcot-Triad is important if you are labeling your patient with acute cholangitis. And it's possible that there may be there would be derangement of the LFT, especially if we talk about alkaline phosphatase, which is actually coming from the biliary tree. Okay, so one is that if these papillomas are not involving the most of the liver or a widespread area of the biliary channel, then the one option is that you can go for a local resection. But sometimes you have to combine it with a liver resection, you have to combine with a bile duct resection, and then sometimes it's possible that the tumor is widespread and it's involving most of the parts of the liver, and the total resection would be the option, and then you go for the liver transplantation in case of these tumors.